Hi, everyone, and hello, Jane. We have been planning to do some series of videos with Jane because many of our customers and patients quite like to watch when we have videos together. And to be honest with you, I think I quite enjoy to have a chat with Jane and share our experiences with you guys as well. So we were planning to do this face to face, but with current situation, we thought we use modern technology and record our first series of video via Zoom. So guys, welcome to Dr.Olha and Jean channel. um, Jean, how are you generally? How are you keeping?
Yeah, I'm absolutely fine. Just waiting for the announcements now to see when we can start to get back to normal. Trying to keep busy. Yeah, just passing the days really. Looking forward to the busyness when we get back.
Well, hopefully it wouldn't be too long. Things looking quite optimistic and hopeful. And I don't know, I feel also betting myself more optimistic about coming back and generally country going back to some sort of normality.
Yeah.
And I think obviously today we're going to talk about some aesthetics. And the first video we was going to make about sharing our experiences with you guys. The most common question when patients come to see us in clinic is it is our existing patients or new patients. They often ask, Jean, have you had this? Or when I would recommend some treatment, they will come out of the treatment room and they will ask you, Jean, have you had this treatment? What was your experience? So we decided today we'll share those experiences, and many patients ask myself as well about did I have this treatment or am I planning to have this treatment, what I do for my skin. I think, Jean, we are perfect team with you. We also like different generation. We have different types of treatment. So different age group of patient could probably reflect and connect to our experiences as well. So Jean, if you don't mind, I will start with you and I will be asking you some questions about your journey in facial aesthetics. So could you tell me when did you first started your treatment?
So back in 2015, I was thinking around my mouth area, and since then I've realised that is a big concern for ladies that are going into the mid-50s or even earlier. So that was what I came originally about after being recommended to see you when we had the room in Anoki at West Bridgeford. So yeah, it was the first thing I did. I had 2 or 3 appointments before I actually went ahead and did it. In fact, I had the first treatment I ever had was a fire and ice facial with you, which was great and gave me the confidence to take the first step. So it's kind of what everyone's feeling when they first come for treatment after they've made that step to walk through the door. I remember it vividly. Will it hurt? Will I like it? You know, will I look like the people on the television? So I did start off very slowly. And even though I did only start off with 1 vial of filler around my lower face, that was the turning point for me, because even though nobody else could even notice, it made such a difference to me and made me feel as though I was investing in myself, investing in my aging process, and it just really made me feel good. And even from that start, I wanted to tell everybody about it, so it was good.
Jean, as we're openly talking about this, I still clearly remember that I we started with your lower face, but I did recommend it to you at that visit that we need to look at
Yeah,
the more full picture and look at the mid face.
yeah,
And obviously now looking back 6 years ago, we have covered all the areas that I recommended in first place and even more. And we're working with you on the maintenance regime
yeah,
now. But could you also tell me what was your, I know that perioral area has been the major area of concern in first place when you came, but which three areas or probably three treatments that we did with you that you would say made the major difference to you in how you felt? Maybe someone else noticed some positive changes, gave any compliments.
yeah. It is really difficult to say because everything that I've had has made a difference and an improvement to me. But if I had to choose, I think upper cheeks, because that again gave me a lift around my lower face as well. So that made a big difference. And like the look underneath my eyes is completely different to me and something that really had bothered me since I was in my 20s. So puffy eyes, dark circles. And now that's the thing that I notice most on photographs if I look back is the difference around my eyes and what a change it has been. So carboxytherapy you did for me probably 10 sessions before we risked doing fillers under my eyes. And then I did just absolutely get fabulous results that have got better over time. And probably 6 months ago, I would have said my lower jawline was a big difference, which it is. But last time I had some maintenance, you decided to do some temple fillers that again enhance the shape of my eyes and took out more of the lines there to the point really when I have my Botox there, there's not lots of smile lines there anymore. So yeah, it is difficult to choose, and it's a combination of things over the years. Uh, but I am really pleased with the results.
And if you would look back, Jean, do you have, would you say, is there is any regrets in taking this step on positive aging and having maintenance treatment, investing in yourself, obviously, every year? And uh, I'm very pleased to say I do think year by year you're looking better and better. But how do you feel about it all?
I definitely don't have any regrets. There are things that I've done over the time that I probably didn't get the result that I was expecting. And probably I wouldn't do again and would do something different. But then some of the things that I have not actually got on with, I've seen other clients have fantastic results. So it's definitely personal and definitely specific to different people. So like the advice that we take is absolute paramount really, and good feedback. So if there's anything that anyone's not happy with or really overly happy with, then tell us about it because it's going to make improvements for everybody.
So, Jane, you said there is a certain therapies you found that wasn't met your expectation to the point you
Yeah,
were expecting
yeah.
the result to be. So, let's just share with us as what you found, where you found that treatment probably wasn't as effective for you as you wanted it to be.
Okay, so I have had video threads, as you know, in my upper face and lower face and in my neck. And when that was kind of ready for redoing, the new Juvederm filler came out that was specifically for lower jaw. And I felt when I had that treatment that I got as good a result with the fillers as I did with the PDO threads. So even though I wouldn't rule it out in the future, I do feel as though the maintenance right now is as good with those fillers as it was with the threads, and much less traumatic.
Well, I'm very much agree with you, and it is about choosing the right treatment for the right patient. And sometimes, when we achieve certain result, maintenance treatment could be more holistic, and definitely choosing least invasive option. Absolutely, 100% agree with you here. Patient not always looking forward to have this treatment again at the nearest future. So it's good to know that there is other alternatives available as well.
Yeah. And I think as well, the procedure itself has got more refined over time, and everybody's learned from different people's experiences over the years now. We've been doing it for a long time. So maybe somebody that tried it somewhere else 10 or 15 years ago might have a completely different view on the procedure if they had it now in clinic.
Oh, absolutely. Aesthetic medicine, I think one of the rapidly growing and have a lot of positive developments over years, where treatment become less invasive, more result driven. And I think what is quite important, it's a lot of attention paid to safety aspect of those treatments.
Yeah.
Great.
Yeah. And the natural look of it as well is.
Yes, absolutely. So, no, Jean, thank you very much for sharing your journey with other people. And I hope other people will find your experience useful, and they might have more questions to ask when they will come to see us in clinic.
Or they can call me.
Or they can call you. Yes, absolutely.
But the thing that I wanted to ask you is, obviously people will say, why do you have any? You're very young, you've got lovely skin, why would you do that?
So that is a very good question, Jean. And I'm 37 now, but I started to have cosmetic treatments from the age of 27. My first actually introduction to aesthetic was at the age of 25, but it was purely cosmetic. I have had a lip augmentation, probably like many girls at this age group, thinking about plumber, modifying fuller lips. And I have had this, but as kind of anti-aging and skin health driven treatment, which is orientated in clinic and professional one, I started to have on regular basis from the age of 27. On occasional basis, I have had those treatments even earlier. I have them from the age of 19. I'm not talking about injectables, but treatments like microdermabrasion and medical grade facials. I used to have them in my home country because I just wanted to put my skin in the direct my skin into a healthy aging process. Aging process starts very early, as we know that, and everything what we do to prevent is helps us with the positive aging. So the main reason why I choose to have some injectables treatment now and have had them for last 7 years is because I believe that preventing and treating small problems is much easier. And I hope that I will be for a very long time at this maintenance stage rather than coming to the full treatment plan. I'm sure it will be time when I would need to do this as well. I also absolutely 100% like natural look. I don't want people to notice that I have any treatment, but I would like to see the result myself. a very important thing to say as well, I never do self-treatments.
No.
I believe that this is a wrong approach, and unfortunately, a lot of bad examples of cosmetic treatments I have seen among practitioners who offer those treatment, and
Yeah.
many of them practice self-treatment on routine basis. I'm not talking about generalization, but some practitioners unfortunately ended up this way.
Yeah.
I have my practitioner who I trust,
Yeah.
and that is a person who trained me many years ago. But I think a good thing is that I can plan my treatments myself because I kind
Yeah.
of know what I need. But I think to have an other person advise an opinion is very helpful.
Yeah.
So, would you want to know what I have, or?
Well, I know what you have. Do you want to share it or say what is the one that's made the most difference to you?
I would say those that made the most difference and that I like a lot, I would say um, probably the one that makes the most difference, in my opinion, two treatments. It was dermafiller treatments again, and it was my cheeks and a tear trough area. And tear trough area is the area that myself, from the patient point of view, it wasn't the areas that I just jump on straight away. It was the areas that I have been inside quite worried about, because I know that this is a risky area and there is a lot of things that could go wrong. However, the practitioner who did it for me, I absolutely trusted implicitly. And I have been very happy with the result. So I needed just a minimal amount, which is also a big advantage, and put a lot of ease in my mind of having this treatment. So I definitely would have it again. And eyes probably one of the main area of my concern.
Yeah.
And when I have had teardrop, I just, one thing I regretted it why I didn't do earlier. So
That's the thing that I notice most. If you've had that done, it does make a difference. And you don't do it regularly, but it is definitely your area. If you're tired, go a bit dark under your eyes. And when you've had your treatments, you always look wide awake and ready to go. So that's what we need.
and that is how we want to look all the time, right away. We don't want to look tired.
Definitely.
And for me, I do quite like skin treatments. So
Yeah.
I truly enjoy treatments like Profiler. I wouldn't say that it gives um, a dramatic difference, but it's the feels that I have in my skin. It's how my skin feels. It how my skin looks and looks. It how my skin feels to touch.
Yeah.
And I know from medical point of view and from practitioner point of view that if I have this treatment on regular basis, my skin it will pay off when I am 10 years older.
Yeah.
So the collagen in my skin, reduction in appearance of fine lines and
Yeah.
wrinkles. So I think some treatments you not necessarily need to expect a dramatic improvement right now today. You need to think how I want to look in 10 years time. And
Yeah.
sometimes to look good in 10 years' time, we need to start taking actions today with
Yeah.
addressing skin health,
Yeah.
which could be done in multiple ways. Skin care, skin treatments, treatments at home.
Yeah.
What actually, Jean, do you like to do for your skin? What is your thing? Do you like facials, peels, or do you more of a skincare lady?
So I always use good skincare, and that's while you were speaking then, I thought how much we've learned over the last years, 5 years, 6 years, of what to use and what to use together to get the best out of the home skincare. Peels, I absolutely love to have a peel, and the Environ facial as well. I see really good results from. So sometimes we don't get the time in clinic to do that. So to keep things up at home is an absolute must. And even in the times as we are now, where we're not going anywhere, I still do it every single day without fail. I don't do one day without doing my skincare regime.
That is very important. I think the key to skin health is consistency as well. So I think treatment in clinics is great, and we all probably come to the point where we need a little bit extra help that is more than just skincare. And again, it's driven by absolutely everyone individual choice. Some people happy with having a healthy, nice skin, and they don't look for any more improvements. Most people do. It's everyone individual choice, but I think having a good skincare regime at home is essential.
And I know when you've been doing my injectables, that you've been able to tell that my skin has got thicker from using the products, the medical grade skincare that we sell. You can tell the difference when you're doing my injectables now. So the thickness, so the collagen has been helped along the way. So that's good.
Absolutely. And it's very interesting because I started my journey in aesthetic probably in a slightly different way than most medical professionals. A lot of medical professionals who transit into facial aesthetic, they go straight away into injectables. I started my journey with learning about skin treatments and skincare, my medical microneedling, chemical peels, prescriptive skincare, and then later on moved to injectable side. And I think this knowledge of skin health and skin aging has helped me a lot to understand my patient aging process. And I'm really proud to say that we were able to accomplish the place where we can help patient with absolute full natural beautiful transformation. So they have their skincare, they could have their injectables in clinics, facial and treatments, and even if they have a special event, which hopefully will be back soon, they can have a nice makeup done and have and feel absolutely fabulous.
Yeah, definitely. Roll on the time.
Yes, absolutely, absolutely. Yesterday, by the way, Jean did my vitamin C mask in the evening, knowing that today we will be doing recording.
Yeah. I've got exfoliator this morning, so I'm on an exfoliator day.
It is skincare regime. It's very nice to keep up with it.
Yeah,
absolutely. Make a big difference when you put your face on in the morning. Make a big difference to
it does, without a doubt. Yeah.
Well, guys, I hope you enjoy our chat today, and give us your feedback if you want to hear maybe some specific topics. Maybe you want to talk us about something specific. Maybe you have some questions. You can always message to us. You can comment on the video. And we will be back soon with some new videos and new topics. Thank you for watching this. And Jean, thank you for joining me for that video.
Thank you. Speak to you soon. Bye.